Hey again, everybody, and welcome to another episode of Spilling the Teeth. My name is Dr. Ryan Hungate. I am the Chief Strategy Officer and Clinical Officer of Henry Schein One. And man, are you in for a treat today, because not only do we have an unbelievable person with Chris Butler, the VP and GM of dentalplans.com with us today, but we are talking about something that will change the game for you this year, right? Chris, first of all, welcome to the show. Thanks for taking the
Thank you,
time.
Ryan. I appreciate it. Looking forward to it.
Cool. This is going to be fun. So today we are talking about cracking the code on treatment acceptance, or the other F word, financing, right? So
hmm
this is like a big thing in an office, because I think like both go hand in hand, right? Right now, it's really interesting. When we started, like, we recently came out with this great report that kind of shows where people are on this. Okay.
hmm
And it really surprised me. Becker's Dental, they showed that right now, 1 in 4 patients accept a treatment plan. That's insane,
Yeah.
right? Like that's really not an amazing thing, right? And I don't know, like, about you, but like I've seen recently, consumer sentiment is not the best. Like, what are you seeing in the market right now? Because I know that you've got the
Yeah.
pulse on this.
Yeah, for sure. Consumer sentiment is at its lowest rate since 1952. And so the
Okay.
University of Michigan puts out this consumer sentiment index, and it's been going down. It's gone down 5 months consecutively. And I mean, I think we all see it, right? We
Yeah.
understand what's happening in the macro environment. And when that happens, consumers pull back a little bit. And they're making decisions differently. And it's not necessarily a fear thing. It's behaviors change with the environment that you're in. So you start to understand. I mean, I'm doing it every day, right? And I'm making
Yeah.
decision of saying, do I really need to buy that right now? Well, maybe not. Maybe I'll pull back. It's that discretionary versus essential kind of purchasing behavior that changes on us. And that's where the sentiment really drives.
Yeah, no, I completely agree. It's funny. I have my first kid on the way next month, actually. And
Yeah,
for the
congrats
first time
again.
ever, thanks. Yeah, for the first time ever, like, I'll look at something and be like, oh, that could go to her college fund. And I've
hmm
never thought about that in my entire life, right? So, like, I don't know if it's the getting ready to have the kid thing, or it's my consumer sentiment, but it's probably like a
Yeah,
perfect storm of like not good, right? And
yeah.
and look, like I said, we were both what is it called, a couple without kids, and we were just living high on the horse. But like
hmm
everybody else has got kids, this is like compounded on top of all these things, right? So. I know the other piece about this is I just still don't think that we're doing a great job in the industry about transparency and pricing. Now, what I mean by
Yeah,
that is that, you know, right now, I'm not saying throw your prices on your website, right? Like,
right.
I think a lot of people see that and they're like, no, why would it be? No. What I'm saying is that when we check people out and they go, how much is this going to cost? Maybe, just maybe, we should be able to tell them how much it's going to cost to a
Yeah,
T,
yeah.
right? Like, so I don't know what you're seeing in the market on that
Sure.
too.
Yeah, so I love my stats, right? So JP
Okay.
Morgan put out a stat. 90% of consumers say it's important to know how much they'll owe before they visit the practice, right?
Interesting.
And I mean, it makes sense. You're going to go in. If you're having preventative cleaning, you're like, okay, I understand this. I've done this my whole life. That is more of a certainty. But if you're going in and you know you got pain, you got trouble, you want to know. So even a range of kind of what am I looking at?
Yeah.
And again, it's because you're making decisions every day. And so if you're walking in with no idea of whether it's going to be $200 or $5,000, that makes a consumer really anxious in the
Yeah.
moment. And anxiety in that moment is not what the practice wants the consumer to feel as well.
Completely agree. So, what's so interesting is I'll bet that people are looking at their schedules and going, wait a second, Dr. Ryan, my seats are full. I'm booked for 3 months. My numbers are down.
hmm
Wait a second. Just wait a second. Because everybody out there, like, everybody talks about, I want to get butts and seats. I personally think that's an old school way of going about things. I
Yep.
really do. If
Yep.
you talk to any of these large DSOs who have paid large consultants to do all of this work for them, and like, let's take advantage of that for just a second.
Okay.
They are using a topic called same store growth. What the hell does that mean? That means I've got enough patients. I want a patient that when they're in the seat, they say
Mhm.
yes to the right treatment, a comprehensive treatment plan, not just the filling they need that day, not just the cleaning they need that day, but the clear aligners, but the whitening, right? The perio maintenance, whatever it might be that they actually need, right? I think we have to get out of this mindset of button seats. We've mastered that. We're really good at it. We're really
Yeah.
good with advertising, right? I mean, tell me what you think. Like, obviously you said consumer confidence down,
Yep.
but what does that actually mean at the end of the day?
Yeah, I think it's going to be a few things and pulling them together that we've said, right? You started this episode by saying 1 in 4 people accept a treatment plan. It's
Yeah.
important for all of us to realize that treatment plans aren't put together to increase same store growth. That's not why we're doing it. We all
No.
want the right health outcome, right? And so the gap that we're not bridging effectively is the treatment that's needed, what the impact of that treatment can be to you moving forward, and then the value of it versus the cost of it. And
Yeah.
there are levers in market that we can pull to make the cost more attainable to a patient, right? Whether it's in the moment, whether it's before they walk in, having a little bit of certainty. And so I think that's where the opportunities are, because we're really seeing the data tell us that, you know, 81% of patients are hesitating on a treatment plan because it's cost concern. Half of those patients, it's cost concern that they're walking out. And
Yeah.
we're not effectively communicating value and need versus cost.
Yeah. It's funny. I haven't seen a car commercial lately where they're like, come on down to the Toyota dealership and drop $42,000. I just haven't seen that. I don't know why.
Yeah.
But at the same time, since I've been around, I've
Mhm.
only seen come on down to the dealership and drop $329 a month,
Yep.
right? Because that fits my budget. I can find out how I own a car. Nobody is throwing $42,000 down. Why are we looking at patients dead in the eyeballs and going, hey, it's going to be $3,600? And then we go cross eyed
Right.
when they say no,
Right.
right? Like, I mean, I think you have some decent stats on, or you probably have some decent stats on like costs of average treatment. Like, talk to me a little bit about that.
Yeah. So cost of average treatment, what we see at HS1 is about
Yeah.
$360, right?
Okay.
Which
Yep. That
on the
sounds right.
face of it, does that sound like a lot of money? Maybe.
Some
Maybe to
people.
you and me. I mean, I'll tell
Yeah.
you, I don't open the window and throw out $360. That's not what I do,
No, that's
right?
right. Yeah, me either.
But the reality, when we get to know the people walking into our practices, they
Right.
have $500 on average in their checking account.
Houston, we have a problem.
Right.
Yeah.
360 for the treatment. I have 500 in the account. My account is not set up to just fund my dental treatment needs, right? Take it a step further. 37% of Americans can afford an emergency expense over $400. They just simply can't afford it. And
I've gone to the
so,
grocery store and it's cost $400 on accident
well,
sometimes. Like,
I
that's
forget
not
about
good.
it. You
That's
know,
not
my,
good.
my
Yeah.
favorite big box warehouse store, I can't walk out
Oh,
for
I'm
under that.
crushing Costco for 400. Absolutely.
Oh,
Yeah,
you
that's right.
know, but so that's what we're talking about in reality. It's when you're dealing with consumers, and I've been a consumer business leader for a long time. It's really difficult to step out of your own perspective of the world and step into the consumer, your target, in this case, your patient. You have to understand where they're coming from. And that doesn't mean that you have to discount the hell out of your treatments. There are other options out there.
Yeah, it's interesting. I always used to say nobody goes to the doctor hoping they can't afford what they need.
Yep.
It's not like they're walking into Gucci,
Mm-hmm.
like where they're looking around going, yeah, I probably can't do any of this stuff. And they're working out, walking out. Like, this is different. Most of the time, or sometimes there's pain, right? Sometimes there's deep concern for aesthetics, where they're self-conscious of something. Maybe
Sure.
they had somebody comment on something and now they're walking out thinking, not only do I not get to fix this and I remain sad, but on top of that, now I know I can't afford it and there's no hope whatsoever, right? Like, that's an awful feeling. So I really think that
Right.
we have to change that. We really have to start meeting people where they need to be.